We're back on the Monday edition of Morning Barbados, and as usual at this time we say good morning and welcome to Dr. Andrew Forde, or dermatologist. Good morning, Dr. Forde.
Yes,
good morning.
Good morning, Cassandra. Good morning, Doug.
Yeah.
Happy birthday, Doug.
Everybody
Thank
has
you.
to sing him happy birthday. I'm just kidding.
All right, we'll do that at the end.
I'm kidding.
Well, let's talk about ashy dermatosis and the significance in our part of the world. As I understand it, it was first discussed in Central America, I think it was, and it seems to be more prevalent in people of darker skin, Afro-Barbadians, Afro-Caribbean people, and people in the Hispanic region of the world. Why is that?
Well, why is a very good question. I call it ashy dermatosis because erythema dyschromicum persistens is very difficult to pronounce.
I would have tried that one.
I saw that one.
And it was discovered in 1957 by Ramirez, who's from El Salvador. And he noticed a group of patients with a chronic discoloration of the skin that affects the face, the upper limbs, as well as the chest. And he called it ashy dermatosis.
Okay.
As to why it happens there, we have more melanocytes and the containers for the melanocytes called the melanosomes than the lighter skin types. And it must be something related to that.
This is about pigmentation.
Yes,
then.
it's about pigmentation. So you see a lady with the early signs of it, and you notice that it's a bluish-gray discoloration, tending towards a slate color, a slate darkening. And in her neck, you can see that discoloration starting and sparing some of the areas lower down where her clothing would be. So it's one of the things that would make someone appear darker to others who would know them, and that can be quite disturbing for most of us. But it's painless and usually symptomless, except for sometimes some itching. But it can continue for many years. On average, it lasts for about 3 years.
Why does it affect women more so?
Well, that's a good question. It affects both sexes. It affects all age groups from age 1 to 80. But usually it's seen in individuals in their 20s and 30s and their 40s. There's a lot of discussion about this condition, and it is thought that it may be a variant of something we talked about earlier called lichen planus, but just a photosensitive form. And in the end stage of lichen planus, you get lots of discoloration of this type, the bluish gray color and slate color. And that's because the melanosomes are broken up in the lower tissues. So you can see the discoloration of her forehead. I took it this way so you wouldn't be able to tell who it was.
Right.
And you know, that can be quite disturbing. So in actual fact, her whole face and her neck in the sun-exposed areas were beginning to turn that color.
Look at this one on a
this
torso.
is a torso, and this just shows that it can be ovals and patches. Very uncommonly, it can be plaques, and in a few cases, the edges, plaques, they can be raised.
Okay.
And that's the type that is more like the lichen planus. And very rarely, too, sometimes it can have some redness at the edges. Just to show that the upper limbs are involved, and you have those patchy gray areas on the body. But I've seen individuals with it in the sun-exposed areas, and also it can affect areas that are covered as well. The reason for this slide is to show you the progression in this lady who started out with just 2 small patches on the face.
Wow.
But over time, she became dark on the entire face, the upper limbs, and the torso, and it lasted for about 4 or 5 years.
Wow.
You know, it can be quite a debilitating condition, because people will always be asking you, why are you so dark? And you have to try to consider why that may be. But there are some associations, like whipworm infection, and also nitrites, having nitrites in the body, and
I was reading somewhere that people with HIV may be predisposed to this condition.
Well, there have been a few cases of individuals with HIV who've had it as well.
Okay, but it can happen to anyone.
Yes,
basically.
certainly it can.
So sun exposure, how does that fall in line here?
Well, in general, if anyone has an ashy dermatosis, I would advise not exposing themselves to more sun, because you would find that with the progression of the disease, the sun definitely tends to aggravate it. But this is another aggravating factor that's discussed quite a lot in the literature and elsewhere. So in our climates, and you notice that it's in South America and Central America, it's also in the Caribbean and the darker skin types, we really have to consider what the sun can do to these individuals.
So persons with a lighter complexion can get it, but what does it look like? How does it manifest
Well,
on
it
them?
manifests itself in the same way. It can, as I say, manifest itself mostly on the face, the torso, the upper limbs, and they're patches, usually oval patches, and they're bluish-gray color, and they can become confluent or joined together. You can also get them in areas that are not exposed to the sun, like the armpits, the areas that will be covered in the body, the torso. So it looks actually the same way, except for sometimes it can be some redness, sometimes it can be slightly raised, but over time it tends to get a lot worse.
But if you don't, if there are no symptoms at all, isn't it the danger that you may have it and not even realize? You may just think, oh, just a little bruise or a little.
Well, you might at first, but over time you'll realize that it's just insidiously spreading, and that's what disturbs people.
Well, we need to talk about treating. How do you go about getting rid of this ashy
Well, treatment
dermatosis?
is difficult. Over the years, I've come to believe that time is the biggest healer with this thing. Of course, there are other methods we can use. There's sun avoidance. There's the use of steroid creams in individuals that have thicker areas that are still itchy. And of course, there may be cases where you'd use an oral steroid. But the pigment is very resistant. You can use peels, chemical peels, also things that have bleaching agents in them, hydroquinone and retinoids. But there's been some progress using clofazimine, which is a drug that's used for leprosy. It's something that's taken, it's a medication that's taken between 3 times a week, 100 milligrams, or sometimes every day. But of course, it does have some side effects which may be undesirable. So it depends on the severity in the individual and how badly it's going, and also their perception of it and how they deal with it. Sometimes you just need to camouflage it and hide it for a while and give it time to go away. But I'd say that invariably I've seen everyone who I've seen with it has got better in the long run.
I'd like to know where it came from.
We'd like to know too. I think that would be really something.
Yeah, and like why just the upper body? But we'll continue firing all our questions at you
On this
after the
mystery
break.
skin disease, yeah.
Yeah, we'll take a short break and we'll be back. 6:23 is your time as we continue on this Monday, November 3rd. It was a cool night, and we hope that your morning and day stays that way. We're talking with Dr. Andrew Forde, our dermatologist, and we're discussing Ashy Dermatosis. Yeah, and
has nothing to do with the toes.
Nothing whatsoever.
Okay.
Why does it stick to more so the upper body? Is that because
this is a condition that's been mostly observed, and we don't understand the mechanism of it. So it's really hard to say. But these are the areas that get exposed to the sun the most. We'd have our upper bodies and the torso covered to some extent, but the face gets almost sunlight every day, all the time, during those hours. So that's why a lot of these conditions start there.
Do you have to have then a genetic disposition that?
Well, they found some genes, these HLA genes, that are related to it in a group of patients that have had it, but there's no direct genetic carriage of it. So we wouldn't say that it's a dominant gene or recessive gene. But it's important in the early stages that there's some confusion about it, and sometimes you need to get a skin test called a biopsy, where you take some of the skin out and look at it. But again, the results are not foolproof or specific. They're very much like the lichen planus that we mentioned earlier.
I was going to ask you, does it mimic any other skin condition?
Yes, certainly lichen planus is a big discussion point. This is we talked about lichen planus where people get what I call the papulosquamous eruption. But this is one where the inflammatory part isn't observed, and you just see the discoloration. As I said, the pigment, instead of being in the cells that they should be in, the melanocytes, and in the little containers called the melanosomes, they're scattered in the deeper tissue called the dermis. And that's why these conditions last for so many years, because usually the melanin is compartmentalized, but in these cases they're scattered around. But in that lady in the last slide that we showed, you notice that she had some areas that started on the face that looked rather innocuous, a lot like melasma or chloasma, which we mentioned last week, which happens to a lot of pregnant women or women with time and the sun, and are also oral contraceptives. And you know, it's another pigment disorder that affects the curves, start to get affected first. But only thing is that in that condition, above the lip always gets affected, so it starts to look as though the person's getting a mustache. So that's one of the clinical.
Don't start looking
okay, we're Cassandra looks good. Cassandra looks good.
Okay.
She's safe. But you know, that's one of the things that it can be confused with. There are also times when you can be on a medication, let's say a type of diuretic that has in what's called a thiazide, and you can get discoloration with the sun. So this is what is a photoreaction or a type of photodermatitis. So you can have a photodermatitis where the sun exposed areas get affected, and in that case the face gets affected more. The neck, if the person wears, let's say, V-neck tops, you know, you notice that it's distributed in that shape, and it gets darker, but not quite that bluish gray or slate-like discoloration. It's not as deep with the pigmentation.
Okay, I want to understand why. What does leprosy and this condition have in common that medication would seem to help?
Well, in a lot of dermatological conditions, we use drugs that may be discovered because there was a patient with a concomitant infection, and there was noted to be some improvement, and they use it in that way. But it just deals with the white cells and the immune system, and somehow it helps. But again, the mechanism can't be you know, described perfectly. But a lot of things are found by accident. That's what experimentation and science is all about.
This may be a foolish question, but I have to ask it. If you don't know what causes it, how do you know how to treat it?
Well, it takes time, and you know, through studies, you tend to see what helps people. But again, when the amount of medications that are used for this condition are quite large. Even griseofulvin, which we talked about earlier for treating tinea in children, the scalp ringworm is used, and there are many other medications. So obviously that tells you when something has a lot of oral treatments, it means that the exact treatment or treatment that works perfectly has not been discovered, and people try lots of different things. They write about it in journals, and then they try to make a compelling case for it, like another medicine called dapsone is used. And we also noticed that a similar type of medication was used when we talked about discoid lupus. So this is something that is pervasive in autoimmune conditions and other conditions that are not known to have a specific cause.
I wanted to ask you, and our guest this morning, of course, is Dr. Andrew Forde. He's a dermatologist, and we're talking about what, Cassandra?
Ashy dermatosis.
Ashy dermatosis.
Just want to make sure you were taking
She's
proper
the
notes.
linguistic expert here.
Yeah, one of the things that we are noted for in this part of the world is not only self-diagnosis, but coming up with all kinds of treatments. Is there a danger using things that may not work at all on ashy dermatosis, but cause other complications?
Yes, well, there's always a risk of that, because when you have something that's chronic, you may become desperate and try many different things. And you know that in our region, especially in Barbados, you always get some suggestions from well-wishers and people who think they can help you. Sometimes it can have bad effects, but sometimes it doesn't cause any harm.
Does this happen more so in our neck of the woods? Because is it that our sunlight is much closer? Because is it prevalent in the U.S.? That's what I'm trying to understand.
Yeah,
Is
well,
it
it's
temperate
seen throughout the world, but
Okay.
the prevalence of it has more to do with the type of genetic pool that's in these areas, because you know we're talking about black individuals, Hispanics,
Right.
and Indians.
Okay.
And one of the things that we should mention too that distinguishes it from the lichen planus type is that the mucous membranes, that means inside the mouth or the genitals, are not usually affected, and with the lichen planus, that can also be, you can also have discoloration there. There's also something called Addison's disease, where you have a problem with your adrenal gland, and that affects your pigmentation. So that's one of the things that is usually ruled out with this condition. But when you do blood tests or x-rays or any type of examination, these patients are completely fine. So the problem is just a skin problem.
I'm just thinking about this. You know, you're going to a GP to try and figure this out. If the dermatologist has a challenge, you know, just a thought.
Yeah.
I'm just wondering, how prevalent is this ashy dermatosis in Barbados?
Well, generally, I would say I see at least 2 or 3 people with it every year, and the severities can vary, but usually there may be 1 or 2 people that I'm working on over a period of time to just get it better. But in some cases, it's just minor, and in the early stages, I find that if you try to avoid excessive sun, it gets better. But it's interesting because some people have tried light therapy with it, like ultraviolet B therapy.
I was going to ask you
there
about
are
that
other
earlier.
there are other you know, writings in journals that suggest that this can help. A lot of these things are anecdotal, meaning that someone may have a patient, they try something, it works, they can write it up in a journal, then people try to get groups of people and try it to see if it works. But there's no one thing that works, so you have to get a multidisciplinary approach when it comes to your treatment.
Okay, so what about, you know, sometimes you see very, very darkened elbows and thick. Is that a type
no,
of it?
that's not a type of
friction?
It. Well, it's not friction. It's something called a keratoderma, where there are individuals that have skin that's thicker than in other people. So this can be manifested on the palms or the soles. On the palms of the soles, it may look a bit yellow in color, or a bit carrot-like in color, and it's very thick, and it can have splits or little hard areas. But also you can get it on the knees and on the elbows,
get rough,
with very dark, thickened skin, and also the sides of the feet, the dorsum of the feet, on the hands. So there's some people who genetically have that.
An abnormality.
No.
Okay.
It is just. Well, there are many things that cause discoloration. As people of color, we're always concerned about being darker. And this is something that happens to a lot of people. And if you look within their family, you may find other individuals with it.
And what's that called again?
That's called a keratoderma.
Keratoderma.
Keratoderma is like a thickening, and the thickening can sometimes be darker, or it can just, if it's on the soles or the palms, there isn't a lot of pigment there, as you know, so you just see the thickening there.
Socks and Vaseline used to fix everything.
Yeah.
Yeah, well, Vaseline's a good thing.
Anyway, well, just to recap quickly, for persons who may see this darkening, you know, don't take it lightly, because if it's time that could work for and against you, you need to get to the dermatologist as soon as possible, right?
Yes, certainly it's important to be able to distinguish between the causes of darkening of the face and the upper body. So if you see it, especially if you're a young person, you may be on the pill or have had some children, and that may cause you to have the chloasma or melasma, which is more common. But once you notice that it's starting to affect other areas and getting that slate-like color, you should be worried about it.
Especially if you worry about your aesthetics.
Yes, definitely.
Exactly.
But it won't kill you.
No, it won't kill you.
That's good news.
But it can last for a heck of a long time.
Can it stay forever? Like, does it not go away with some people?
Well, all the people I've seen here
3
have got better,
seconds.
but of course, some people can be more unfortunate than others.
Okay.
Dr. Andrew Forde, thank you for opening a whole new Pandora's box this
Can of
morning.
worms.
Yeah, let me tell you, that people running around this morning worrying about this mark and that mark. But it's safe, don't worry, the doctor can fix it. Thank you very much, we certainly appreciate it. We're going to take a break here, and you know, if the doctor can't fix it,
Maybe the hypnotherapist can.
hey, we're going to post that very question in